Hi, I'd like to welcome you to our Type 1 University sampler course entitled Pizza and Blood Sugar Control, Not Quite Easy as Pie. During the next 10 minutes or so, you'll get an idea of how Type 1 University operates and hopefully learn a few things along the way. I'll tell you a little bit about myself. My name is Gary Scheiner. I've been a certified diabetes educator for the past 15 years. I've written several books on diabetes management, and probably the most famous is called Think Like a Pancreas. I lecture nationally and internationally on various topics in diabetes. I've had diabetes for more than 25 years, and I'm partial to hand-tossed New York pizza. That's kind of what I was brought up on. I'll tell you a little bit about my practice. Our practice is based near Philadelphia. We have a team of diabetes educators, all of whom have diabetes themselves or have a close family member with it, so we live it and kind of get it. We provide advanced education and management coaching on all aspects of blood sugar control. We offer full remote access to our clients. We have clients internationally who work with us by phone, internet, mail, Skype, whatever means is available. Our focus is on intensive insulin therapy. We work mostly with type 1s, but also type 2s who use insulin. And for some reason, every office we've ever had has had a pizza shop right downstairs or next door. I don't know if that's a coincidence or not, but it's just ended up that way. So as an overview for today's program, first we're going to talk about what is it about pizza that makes it such a challenge to manage when you have diabetes. We already know that counting the carbs can be difficult, so we'll talk a little bit about that. Discuss the timing of the insulin so that it's working when it should. And we'll also discuss issues of how fat can influence the blood sugars in a delayed manner. So starting out, why is it so hard to manage blood sugars when having pizza? Well, certainly counting the carbs is difficult because there are probably 1,000 different varieties of pizza, different shapes, sizes, ingredients, and so on. So we're going to share some tips with you about how to make an easier time of counting the carbs in a little bit. There's also potential for delayed digestion of those carbohydrates, particularly if you're having large quantities of pizza. Who doesn't like large quantities of pizza? Or if you're having a lot of fat in the meal that could make it absorb more slowly. Speaking of the fat, there is potential for a prolonged blood sugar rise when we have large amounts of fat in a meal. So as far as carb portion estimation, one of my favorite techniques for doing carb counting is just using a fist to estimate the number of cups of food item that you might be eating. With pizza, that's not so practical, so what we do is we use a flat hand. Your hand with the fingers together for an adult, that's about a 30-gram slice right there. So if you take a hand-tossed average thickness crust, if it's about the size of your hand, you're looking at right around 30 grams of carb for a slice that size. If you're having a very thin crust pizza, count that as about 20. If you're having a thick crust, possibly a Sicilian-type pizza, that's closer to 45 grams for a hand-sized piece. So let's apply that here. We have a woman's hand and a slice of pizza from right downstairs in my building. And when we're doing this, we can't cut corners. The corners do count. So if her hand is actually covering maybe 75, 80% of that slice, we still have this corner segment to deal with. So if we only counted this as 30 grams, we would undercount it a bit. This is more like a hand and a third, we'll say. So that's about a 40-gram slice. Now, there is another way to count the carbs in pizza in a somewhat more precise method, and that's by weighing a portion of food and multiplying it by something called a carbohydrate factor, and that'll give you a total carb count. A carb factor is nothing more than the percentage of a food's weight that consists of carbohydrate. So if you eat something where half of its content is carbs, its carb factor would be 0.50. So to do a measurement like this, you do need a food scale that measures in grams with reasonable precision. You also need a list of carb factors. And there's pizza right there. So for the average pizza, 32% of its weight is carbohydrate. And again, this is for an average crust, hand-tossed type of a pizza. So if you're having a slice of pizza that happens to weigh 150 grams, you can get a fairly accurate carb count by multiplying 150 by 0.32 to give you 48 grams. Got to eat your crust. Don't forget that. So that's a more precise way of getting your carb count. Okay, so you've got an accurate carb count on your pizza. Now what? Well, we've got to time the insulin correctly. If the insulin is going to work too fast or too slow, your blood sugar control is not going to be so good. We have to try to get the timing to work. We know that the blood sugar rise from food is going to be slower if there's a lot of fat in the food. We also know that will happen if you're having a very large amount of food. In both of those circumstances, the food is going to digest more slowly. Now, when we take a dose of insulin, rapid-acting insulin is going to peak in about 60 to 90 minutes, and that's going to wear off in about 3 to 4 hours for most people. So the problem we run into is if you're eating a slowly digested food and your insulin is peaking in about an hour, is that your blood sugar could drop at that point. And then a few hours later, when the insulin is gone and the food is all kicking in, then you rise up really high. So you have this problem of a low followed by a high, slow digesting meals. So how do we fix that? If you're taking insulin by injection, you do have some good options. One is simply to delay the injection. Give it 30 minutes, 60 minutes, even 90 minutes after eating. Another option is to split the injection. Instead of taking it all at once with the meal, give half with the meal, give another half hour, hour and a half later. You can also go back to using regular insulin. That's the old stuff that works slower than our rapid-acting insulins do now. Regular insulin peaks in 2 to 4 hours. So for a slow digesting meal like 3 slices of pizza, it's not a bad way to go. For those who use an insulin pump, we have special features that allow us to spread the bolus out over a period of time, and that can really help with a slow digesting meal. We can extend or square the bolus, whereby all of it is spread out over time, or we can use a dual or combination bolus, where some of it kicks in all at once, but the bulk of it kicks in several hours later. My personal preference is to give about 1/3 of the bolus immediately and 2/3 of the total bolus spread out over about 2 hours. I find that combination to work pretty well. And it gives us an action curve for our insulin that matches the food absorption much better. Okay, we've counted the carbs. We've timed the bolus just right. So can we relax? Not yet. We've got one more thing that we have to take into account, and that is the fat content. If you're having pizza with a lot of fatty toppings like hamburger meat, sausage, pepperoni, or if you're having several slices, there's going to be quite a bit of fat in that meal. And fat has its own unique effect on blood sugar, and this is separate from the carbs. Fat itself can make blood sugar rise over a prolonged period of time, and it does so kind of indirectly. It'll actually make your triglyceride levels go up, and when that happens, your liver doesn't work with insulin quite as well, and it starts to dump out extra glucose. And as your liver dumps out extra glucose, your blood sugar is going up for an extended period of time. But we can offset something like that. If you take insulin by injection, you can use some NPH. It's the cloudy insulin that peaks in about 4 to 8 hours. Taking a few units of NPH after a high-fat meal can offset some of the effects of the fat. If you're on an insulin pump, you can raise your basal rate for a period of time. I like to raise mine for about 8 hours by around 50% when I have pizza, and that seems to offset the effects of the fat. If I don't raise the basal after eating pizza, I might have a normal blood sugar at bedtime, but the next morning I'm going to be really high. So this is the feature that keeps your blood sugar stable overnight. So yeah, there is work involved in managing blood sugar with foods like pizza. The good news is that you can enjoy them and you can manage your blood sugar if you apply these types of strategies. Personally, I think it's worth it because I love pizza. Now and then I like to indulge. But if you count your carbs accurately, If you time your insulin correctly and you take the fat into account and take your basal insulin level up a bit, you can manage your blood sugar very well. So I want to thank you for watching. If you haven't had a chance yet to check out Type 1 University, I hope you will. We offer a variety of classes on specific topics in diabetes care. So you don't have to sit through hours of stuff you're not interested in. You can focus right in on the topic you want. Each class is about 45 to 50 minutes, and we get fairly in-depth on that specific topic. So I hope you'll go check those out. And if anybody is looking for some more individualized help or coaching with their own diabetes management, please get in touch with our office. And thank you very much for participating in our class today. Class is dismissed.